Surgery is just one day, but optimizing the results for your surgery and maintaining the results for your surgery, well, that's a lifetime. Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we're back with Julian, who is the director of our non-surgical side. And today we're going to be discussing how the non-surgical treatments really kind of fit in and synergize with the surgical procedures that we're doing. So welcome, Julian.
Thank you. I'm happy to be back.
So I'm going to dive into some questions, and I'm going to start by asking Julian, what do you think are the most important treatments before surgery, so for facial plastic surgeries, that the majority of our patients should be doing before they enter the OR to optimize their results?
Yeah, I feel like there's two sides of this question because there's treatments they should be starting and there's treatments maybe should be stopping, if that makes sense. So if it's a patient who does their neurotoxins or has passed like dermal filler, they should be, dissolving their filler or, stopping their neurotoxins at some point to go ahead and then there's a side of it with pre-treating. So you want to pre-treat the skin, have everything ready to go, especially if you're doing like a CO2. You really just want to have that skin's integrity ready for, to help with the acceleration of healing for incisions or, you don't want to cause hyperpigmentation with certain procedures. So, starting on retinols ahead of time, I think is really big, which is going to be helpful pre and post procedure. But we can dive into all the different things as well.
Yeah, so Julian brings up a very good point, especially with the neurotoxins. So if I'm doing surgery anywhere around the eyelids, then obviously I don't want that patient to have a neurotoxin still active in the system. And that's because I need to really truly evaluate the position and movement of the eyebrow. If I'm doing a brow lift, if I'm doing eyelid surgery, I don't want any weakening of the eyelid muscle, especially for lower eyelid surgery. So we really want to make sure that all of the neurotoxin is out of their system to get the best possible result. And Julian mentioned the CO2 laser. So there's a lot of preparation that goes into optimize the results for CO2 laser, making sure that they don't have post-inflammatory hyperpigmentation. So getting a hydroquinone or alternative sort of melanocyte inhibitor in the regimen. And then also Retin-A to really kind of prep the skin to make sure that the skin is going to have the best possible result in terms of regeneration after that procedure.
Exactly. Yep.
Okay, so patients had a deep plane facelift, right? And most likely a number of other procedures in our practice.
Right.
Okay. Walk me through what specific products you're going to recommend for our average patient at really specific landmarks and specific times.
Definitely.
So what does that look like?
Yeah, I feel like there's definitely different phases. So there's a phase of like immediately after surgery. You really want to follow all of your preoperative and postoperative care, but then you're going to want to throw in medical grade skincare. So things like a growth factor to help with incisions and healing. We carry the Hydrinity Hyacinth spray here, which is really nice because it's anti-inflammatory and antibacterial. And we can actually put that right on incisions to kind of help, especially for those patients who are like, I can't get my incisions wet and I can't shower. I'm like, well, this is going to be your perfect, product to be using. So we try to give that to every single person.
Yeah.
And then a good silicone-based scar cream as well. We'll go into that regimen a couple weeks after surgery.
Yep.
That's going to help again with some incisions and help with minimize any scarring or anything like that. Using gentle cleansers and a gentle moisturizer, protecting your skin from the sun. SPF goes a really long way.
Yep.
But moving into terms of like growth factors, so we carry like Plated Intense, which is an exosome treatment. That's going to help with that accelerated healing. The point of a growth factor is to regenerate, reheal, and you really want to introduce that post medications or anything like that in order to optimize that result.
Yep.
And then you can start moving into your more aggressive, active products, I would say. So you're going to want to start doing your retinols again. You hopefully are doing that to pre-treat. So post-treatment, that's going to help cellular turnover. So that's going to help with that skin's integrity as well, which I think is amazing. So it's kind of going like in a gentle route and then kind of getting more back into your actives and your more aggressive route.
Okay.
Before obviously doing like non-surgical treatments as well.
Great. Okay, so I have a the typical question for you.
Mm-hmm.
Let's break it down by decade, right? Let's do 20s, 30s, 40s, 50s, 60s.
Yeah.
All right. And just kind of carte blanche, you're going to recommend 3 products for each of those decades.
Definitely.
All right. So 20s, what are your 3 products?
3 products for 20s. Would this be, I would say, undergoing like a procedure or anything like that? So obviously a cleanser is number 1, and that's going to go across the board. We have a great Prelude cleanser in our clinic. For 20s, I would also say moisturizer and SPF. You don't really have to take care of your skin that much when I feel like you're in your 20s. You do,
Really?
you
Okay.
do, but I would say it's more aggressive when you get in towards those 30s, 40s, 50s. If that
All right.
makes sense.
But we're trying to prevent, right? Not just,
True.
we're trying to be proactive.
True.
And not reactive.
Yeah, so I would say for 20s, I would go, like I said, a cleanser, a moisturizer, and SPF, and always a retinol as well.
Perfect. Okay. 30s.
30s is when you're going to start wanting to introduce your growth factors. So
Okay.
I would say bringing something in that's going to help minimize fine lines and wrinkles. It's going to help regenerate cells, regenerate the skin, and also help with preparation and recovery afterwards.
40s.
40s, I would start introducing everything together. So, like I said, cleanser, retinols, SPF, as well as your growth factor. But
Okay.
I would also even go to start targeting things like pigmentation, or if there's an under eye procedure, or targeting like a good eye serum or a hair product or anything like that.
And where do the antioxidants sort of fit into this? The high percentage vitamin C's and things like that.
Definitely. Antioxidants are great because it's going to be your defense and repair. So I really think that goes across the board, 20, 30s, 40s, 50s, of course. I would say prime is you need to be on an antioxidant during the day to defend and repair. You need to be on a retinol at night to help with cellular turnover and recovery.
Okay. 50s, 60s, we could probably blend that together, but
Yeah.
What are your 3 products there?
3 products there, I would say an exosome treatment for sure. I would say an antioxidant to help with defense and repair, and then a retinol as well.
Okay.
Pretty similar across the board, but you just kind of get more active and aggressive, I think, as you age.
Yeah. And obviously there are a ton of different skin treatment options for patients. And just like with surgery, I think Julian would agree with this. We're going to really try to customize those recommendations based on a lot of factors, patients' desires, skin type, skin darkness, and really kind of where they're at in sort of the skin health cycle. So if you like what you heard today, please be sure to like the video and subscribe to our channel.